Happy New Year. I hope 2025 has started out in a positive way. This is podcast number 62 of NICU and Beyond with Tracy and Stacy. Our topic today is going to be about the Neurodevelopmental Follow-Up Clinic for premature infants. So let's just go over the developmental care overview. The Neonatal Intensive Care Unit Neurodevelopmental Clinic provides evaluation of the growth and development of infants and young children who are at risk for neurological problems or developmental delays because of their premature birth, low birth rate, or any other problems that happened at birth, such as a cooling baby or a shoulder dystocia where they were not getting any oxygen. It's so important for early intervention if there is a slight risk that your child may be exposed to potential neurodevelopmental disabilities.
So behavioral health evaluations are needed to ensure that your child grows up and develops properly. Most of our babies in our unit where I work are ordered neurodevelopmental clinic after they go home. Most insurances will cover the cost of the appointment, but you need to check with your insurance if they're going to cover this. Most of the times, the team that you're going to be working with the pediatrician can get it finagled and ordered that your insurance will cover it. For neurodevelopmental clinic, it's a special examination that's formed by a pediatric nurse practitioner or a clinical psychologist. Don't get worried when we say psychologist because this is just part of the evaluation. So the first thing they're going to do is check the neuromotor function. This is your muscle strength or weakness. You'll hear about this in the NICU when you're there. Oh, look how good he holds his head up. Look at that neck control. Side note here, that's what tummy time's for. So make sure that your kids get tummy time. Growth and nutrition. Are they growing? Are they having enough intake? Are their calories what they should be? Language development, ability to listen and talk. We love when we get like 5-month-old babies in our units and they start to babble and we start doing mom, 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 and dad, 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 just to help them along. Also social interaction, the ability to interact with others. I think that preemies are wonderful at this. They have nurses for 12-hour shifts, usually have a team nurse or somebody that's there consistently. Sometimes your baby will get a nurse every 4 hours, so they get to see so many different faces while they're in the NICU, and I think that they all become little social butterflies when they leave. And also the developmental milestones, the ability to achieve developmental stages. Now just remember that if you have a preemie, that there is an adjusted age up until 2 years of age. So if your baby was born 8 weeks early, a 32-weeker, that baby, when he or she is 2 months old, should be acting like a newborn baby up until 2 years of age. So developmental milestones might be delayed. Evaluation can take about an hour and a half to 2 hours, and the results are discussed with you. Also, if you are ordered early intervention through your hospital, when your baby goes home, if you have a baby with HIE, shoulder dystocia, early intervention evaluations can also order for Neurodevelopmental Clinic.
So now let's identify the infants that are either born in the hospital, go into the neonatal intensive care unit, or in the regular unit in maternity and come back from the nursery because they're having issues. These are some conditions. This is not an inclusive list, but here we go. Those that are usually seen in a neurodevelopmental clinic are babies that have strokes in utero before they're born, experienced a brain injury such as neonatal brain hemorrhage, experienced oxygen deprivation to the brain, prenatal conditions such as congenital diaphragmatic hernia, neurological complications in the NICU. They end up having head bleeds after they're born, genetic disorders identified in the nursery, microcephaly, that means a very small brain, a low birth weight, or a baby that was born prematurity. I know in the unit that I used to work in, it was any baby born below 32 weeks automatically qualified. But again, if your baby's having issues, you can certainly try and get an evaluation done in the neurodevelopmental clinic especially if they're getting early intervention, or maybe some of them are not. You just want to keep an eye on your child so you get the best services.
What type of professionals is including in the team that you will be seeing in the Neurodevelopmental Center or the clinic? It's an interdisciplinary team. It can include healthcare professionals from a wide range of specialties, and they work together to ensure the best possible outcome for your baby. Nurse practitioners trained in development. We have nurse practitioners in our NICU. They are trained in development a little bit, but they're just basically there for the beginning stages of your preemie in the NICU. There are neonatologists. Neonatology is a great field. You can go from working in a NICU into research. The neurodevelopmental specialists. There's also neurologists. Neurologists are the people that deal with your VP shunts, your hydrocephalus, your brain bleeds. Neuropsychologists, evaluation, physical therapists to work with movement, fine motor skills, large motor skills, nurses, nutritionists for, is your baby getting enough calories? Are they taking in enough formula, or are they eating right? Feeding disorder specialists. This is a big thing from NICU. For some reason, can have a baby that sucks on a pacifier, great, and then all of a sudden they get to the stage that they can bottle feed and they totally get what's called an aversion. They don't know what to do when the fluid gets into their mouths. Could be related to tongue tie and stuff like that, but usually not. Sometimes I think we get excited, the doctors start to push, and then the babies are just like overwhelmed. They're like, nope, not doing this. And what my good friend Tracy here, occupational therapy, we love when they come into the unit and work with our babies, and they work with the babies at the Neurodevelopmental Clinic. Speech language pathologists do with feeding disorders also. Audiologists. We have some babies that they will fail their hearing test. We just currently had a 37-weeker that failed on her left twice. We do test for CMV, cytomegalovirus, if they fail. Sometimes it's just a piece of wax or something that the left or right ear doesn't pass, but audiologists are great. If your baby does have a hearing disorder, you can start learning sign language for the simple things. Eat more. And then you have your orthopedics. They are the people, if your baby has a club foot or something like that, they do braces. And there's a lot of people that work in these neurodevelopmental clinics, and it's a wonderful service that can be available to you.
NICU follow-up clinics usually have regular intervals that they see the babies in the early years of development, and that's just a standard of care for all babies that, qualify for the service. The clinics usually occur at 3 months, 6 months, 12 months, 18 months, 2 years, 3 years, and 5 years, with babies being seen for various specialties based on what was going on with them in the NICU and the baby's particular needs.
So as your baby is getting close to discharge in the NICU, our NICU offers a parent discharge class. You can ask your nurse if you think that you or your family is going to be referred to the neurodevelopmental clinic. You can always ask if you think that your baby needs to have this service. There's no problem in asking if your baby can be referred to the neurodevelopmental clinic. Just remember that if your baby was born at less than 32 weeks, it'll be an automatic, but there's other things and diagnoses. If you feel like that your child should be seen by a neurodevelopmental clinic, please speak up. You are their cheerleader. You are their person. Unfortunately, in this day and age, you have to be an advocate for your own child. We hope that our podcast give you a little bit of information so that you can go into your NICU experience or newborn experience and have some information that you can use to help you get what you think that you need for your child.
I hope this podcast was helpful to you. If you like it, please like it. Better yet, you can follow us. Or you can find us at www.parentnicuconnection.com or at the newest website, which is https://peds, capital PEDS.thinkific.com. We're hoping to have another topic, but it might be a month away with our crazy schedules. But we'll have another great topic for you. Have a great day. Bye.
Bye.